All right. Dr. Daniels, how are you? Can you hear
I'm
me?
great. How about yourself?
I'm doing well. I'm doing well. Welcome to this session about specialties.
No
We've had a
problem.
lot
Thank
of
you so much
individuals. Of course,
for
of course.
having me.
Thank you for being here. We have a lot of people that are interested in different specialties, and they put a lot of that information in the chat. We have a little bit of neurosurgery, some gynecology as well, oncology. Somebody said they want to be an orthopedic surgeon.
No
And I see
problem.
that you are a family medicine physician. So can you kind of tell us about what made you go into that specialty or that field? And then also, what it's like on the day-to-day being a family medicine physician. And of course, if anyone has any questions, please feel free to drop them in the chat for Mr. Dr. Daniels.
Thank you so much. So yes, I can answer quite a few of these questions. So initially I wanted to go into medicine at the age of 8 after witnessing my grandmother have a heart attack. And I went to Howard University College of Medicine, and I had a lot of interest in different specialties. I initially wanted to do orthopedics as well because I had a love for the bones, and I wanted to be able to work on athletes. I actually found out that family medicine worked best for me in terms of I'm able to take care of all types of different patients. I take care of from the womb to tomb, as we would say. So I take care of individuals who are pregnant. I actually also take care of young adolescents. I take care of babies. I take care of teenagers. I take care of grown-ups. I also take care of the elderly population as well. What I also did is I have an additional year of training. So after I graduated from med school, I did family medicine residency. Then I did another year in what's called primary care sports medicine. So I actually am a physician who takes care of athletes. I'm a team physician for the Harrisburg Senators, which is the a baseball league affiliated with the Capitals. So I take care of all types of different patients, all types of different people. And there is a wide range of different specialties. And really what it comes down to is what your personality is like, what do you enjoy doing the most. That really helps you in terms of choosing what type of specialty you want to go into. I met my wife in med school, and she loves makeup and modeling and all that types of stuff. And she ended up going into dermatology. So I really think it fits with your personality. And I can answer any types of questions that you guys have for me.
That is so awesome. I love how you talked about making sure you're going to something that really fits who you are, right? I think it's super important to have this in mind because with medicine, it's like a lot of your time is being dedicated to that. And, if you're working 40 hours per week, it's like you really want to do something that feels a little bit comfortable to you. So it's awesome that you work with athletes now and maybe not in the realm of orthopedic surgery, but this is really for those that are listening on the call. If you're still interested in sports medicine, it doesn't have to be through orthopedic surgery. It can also be through going down this path that Dr. Daniels did and going through the family medicine and then specializing further in sports medicine. So that's really awesome.
Yeah, that's correct. There's other ways too. There's physical medicine and emergency medicine as well that you can still take care of patients, and even pediatrics can do that as well. So.
Okay, that's really awesome. We do have a question from John, and I just want to say something before moving forward. I see a lot of you guys are struggling with connection. I'm so sorry about that. I believe my connection is fine on my end. It might be something with the system. Dr. Daniels, are you dealing with any connection issues on your end?
I am not. So,
Okay. So sorry.
I think it's,
Yeah, for those who may be struggling, perhaps going out and then coming back in, so going to the lobby, coming back into the session, that might help out a little bit, but we'll just move on with the questions. So Dr. Daniels, we have a question from Mr. Duncan, Dejano Duncan, and my apologies if I said your name wrong, but they want to know, how did you pick your specialty? And what are some things that you could consider from most important to least important? I think that's a really great question. And then so he said, for example, personality traits. What else? He also said family, money, and location.
those are excellent questions. It really boils down to what you enjoy, and also what is also your priority in terms of if you have a family, if you have want to be in a certain location. I want to go into a specialty because I was about to get married that I would have be able to dedicate a lot towards my family. I also didn't want to necessarily be in the hospital all the time. So I enjoy being in the clinic. I like being in and outside. I love also helping people. So that really helps in terms of what specialty you want to do. When you're going through medical school, there's going to be, you learn about different organ systems. And I really felt best that I liked all types of organ systems. And I really felt that I wanted to help or use my talent in terms of preventative medicine. So therefore, that's the reason why I ended up going into family medicine, because I could help prevent these different types of diseases. I could help prevent diabetes. I could help prevent hypertension. And I really want to look out and see not necessarily how I could treat diseases with medicine, but how I could also help treat diseases by helping out with the environment. So how can I get people to eat correctly? If they don't have those resources in their community, then we have to get those resources to them. So family medicine was the great fit for me.
I think that's very huge. And then you talking about prevention, that's such a huge thing nowadays. And I think when we understand that there are disparities that exist, and it's not just, health disparities, but also geographical disparities that can play a huge role into somebody's nutrition, what they're able to access. I think you being a physician and working to address that is really awesome. We do have another question. I'm just going to go through these questions as they come in. Feel free to drop them in the chat. Somebody wanted to know about delivering babies. And let me get their name. So Danielle wanted to know, have you delivered babies before and how did you handle it?
Oh, that's a great question. Delivering babies is quite exciting because you never know exactly when they're going to come out. And also it's a lot of juggling because you're not just taking care of one patient, you're actually taking care of two. So you take care of the mother and you're taking care of the baby. So that's really important to understand. Babies can come at any time. They could come early in the morning. They could come late at night. They could come during lunchtime. It's a really exciting field. Obstetrics is really exciting. Unfortunately, just because of me doing sports medicine now, I don't practice obstetrics or taking care of pregnant women, but it is an experience. It's one that many people go into, and it is quite fun. I think it's really important in that if we have more women and men who are both going into obstetrics, because it's very important. It's very important to be able to see that both men and women can do this job. And it's really important in terms of taking care of both the mothers and the babies, because women who become pregnant, they need physicians. They need to get the care that they need. And unfortunately, it's really scary, and there's more research into it. But in particular, Black women are having more complications with deliveries, more complications afterwards. We even saw this with Sierra Williams, in which she had a complication after giving her delivering her baby. So it's important that we have you guys in these types of fields to help try to prevent these things from occurring.
Yeah, I think that's really important. And then, your mention of Serena Williams having issues with her child and, delivering that. And we think about her as a celebrity and we think that sometimes they're not having to deal with such issues, but it seems like that's something that's done at all levels. So I'm really glad that you're working to address that as well. Somebody had questions about medical school and how did you juggle everything that was being thrown at you, right? They say it's like drinking from a fire hose. Would you say that was the issue that you're dealing with as well? And how did you handle that?
Yes, that is an excellent point. It is like drinking out of a water hose. The most important thing, though, is that realizing that you can do it, there's been so many people who've gone through this pathway that there's no reason that you can't do it as well. So you have to remind yourself that you're not the only person who has felt this way. There's other people who've gone through this pathway and you could do it too. The main thing is also creating a checklist and setting goals for yourself. So when you get compounded with all this stuff that's thrown at you, you just have to set aside time to say, hey, I'm going to accomplish this amount of studying in this amount of time on this subject. Then I'm going to accomplish this amount of studying in this amount of time on this subject. And repetition. You're not going to learn things on the first time through. So you're going to have to keep just going over and over and over and over. So those are the key things. And also, you have to take care of yourself. You can't just be missing meals, lacking sleep, going into a cubby, just trying to learn all this information. A lot of people end up doing that, and they end up getting lost, losing themselves, losing friends. And that's not necessarily. There's going to be some changes that you have to deal with, but you don't want to have that type of change and where you're trying to find out who your identity is and you're losing it because you're spending so much time studying. If you just realize the reason why you're here, that other people have been through this process as well, and you can do it too, and you just need to prioritize different tasks, you will be completely fine and you'll be able to handle it.
Yeah, the key to the game is prioritization. That's really huge. And I think for those who were on the call on Thursday, Dr. Ledet, he kind of spoke to this about how sometimes people think medicine is, their entire life, but you have to think about it. Sometimes it's like a full-time job, right? And so at the end of the day, when you work your 9 to 5, then you go and do other things that bring you joy. You eat, you go run.
Yeah.
And a lot of times, people say when you get into medicine, if there's one thing that you enjoy doing, whether it's running, scrapbooking, anything that really brings you joy and gets your mind away from studying, don't forget about that. Really stick with doing that. And so that's a really awesome point, Dr. Daniels. There was somebody who was asking, I think he's a third-year medical student. His name is Kevin. He wanted to know if it's okay with dropping your email in the chat, just in case he had any questions for you. I believe he's also interested in pursuing the path that you're on now.
Oh, no problem. Yes, I could do that.
Okay, awesome. Thank you so much. Like I said, I do see that some people are dealing with connection issues. I am so sorry about that. We did say if it might work if you go back to the lobby and then jump back in. I know some people said that still didn't work for them, but I do thank you for your patience, and I hope that you're getting something out of this session today. But moving through the questions. All right, there was one more question that I saw down here. Mr. Duncan has a lot of questions, so we'll go with him. He's asking, how do you not allow stigma from impending on your decision in terms of specialty choice? Let's say people may say surgeons are the real doctors and therefore I need to be a surgeon and not something else, like let's say family medicine. And so he's talking about he may feel like he likes family medicine, but just the outside voices might be swaying him one way or another. How do you kind of speak to that, Dr. Daniel?
You have to listen to yourself. You have to listen to your heart. Okay. So you can go into another field, and if you're not happy, you're not going to be able to provide the care for those patients like you should be able to. You're going to get burnt out. And you really, even when making decisions about the career that you want to go into, you have to listen to your heart. Dr. Lee had mentioned about naysayers. There's going to be people who want to push you a certain way just because they feel that's the right thing for you. But you have to know what's in your heart and what you're called to do. So if you're feeling that a certain specialty is for you, then that specialty is for you. You just can't go upon what other people are saying.
I had a question that's kind of related to that. But, I wanted to know what would be one word of advice, or what is one thing that you wish you would have known before stepping into the field of family medicine, right? I hear it's awesome. You love it. You know, you specialize further in sports medicine, and that's a really big part of what you're doing. But what is one thing that you wish you would have known before moving forward?
I think this comes with any specialty, is pretty much the continual learning and sometimes the amount of paperwork that you have to do. I knew that when going into medicine, that there's going to be a lot of learning, but you're a lifelong learner. And that's a good thing because you're always constantly reading, you're always constantly pushing yourself to be better. And that's one thing I wish I would knew a little bit more about how much reading and stuff I would still be doing afterwards. And that comes, like I said, with any specialty, but it's a good thing. Not to get discouraged or anything like that, but it continues. When you go through the field of medicine, you want to continue to push your skills, to continue to push your knowledge. It doesn't just stop at the end of med school or at the end of residency.
Ooh, that's a good point. That's a good point. And I hear that there's exams that you also have to take, right?
Yes.
After residency, after fellowship. Do you want to speak to that a little bit for those in the audience that may not know?
So after your residency and after fellowship, you do have to take your board examination. And what your board examination, it allows you to be what's called board certified. So what that means is that you possess a certain amount of knowledge that a group of physicians, what they call the standard, possess, that you possess it as well. You can still practice not being board certified, but being board certified shows that you're the real deal. So I took my exam 2 years ago, and I'm not due for another 8 years. So even though you go through school and you have all these tests, the tests still occur. The thing about it is that it gets better because you're not necessarily studying. They're testing things on what you're actually practicing. So you don't have to always necessarily pick up a book to study, but you just have to keep up with the literature, keep up with your journals. And it's not like you're hunkering down like a regular test. It's most of the stuff you already know. It's just applying it. So.
That's awesome. I love how it kind of deals with the practicality of what you're doing. And so it's things that you already know. And so it's not just going back into the books, right? That's really
Yes.
awesome. Some of these other questions, let's see, and feel free to drop them in the chat if you have any questions. Before moving forward, I just want to shout out Lemaine Redding Jr. They're 18, finishing up their associates and accelerating their bachelor's. That's awesome. They're currently a firefighter / EMT and working for their paramedic licensure. And they're interested in interventional neuroradiology. So that's huge.
That's big.
That's really big. Now, we did have a question. This may take you back to your pre-medical days. Naya's asking, how many times did you have to take your MCAT?
I actually took it 3 times. And I'm actually going to tell you my age. When I did the MCAT, it was paper and pencil, paper and pen before the computer. So during that time, you could only take it twice a year, once in the fall and once in the spring. So let me tell you, when I took it the first time, I did okay. But my pre-med advisor said, hey, you should retake it. So I said, okay, I would. So I studied, and in the spring, I got a lower score than I did the first time. I was like, oh man. I applied to medical school and I didn't get in. But I did a post-bac program, which is a program that's geared to help increase your MCAT score. So when I did that program, I had the appropriate MCAT training that I needed. And on the third time, I did well, and I got accepted into medical school that next time. So you can't get discouraged. One of my favorite quotes is by Michael Jordan. And he states that he's missed over 3,000 shots. 26 times he has been entrusted to win the game-winning shot and missed. He's failed over and over and over again, and that's why he succeeds. So there's going to be failures in your life. It's what you do, learning from them, what pushes you to the next step. So don't get discouraged by failures. Learn from them and overcome.
That is a huge point, y'all. One thing I've learned, I'm not even in medical school yet, but I've learned that resilience is the name of the game, because you are entering into this field where there's things that are, it's very, how's the word to say, innovative, right? There are things that are new treatment options, new ways of doing things. And so you're always learning, and you may not get something the first time, but best believe that if you try again, that you'll get there, just like Dr. Daniels did. So thank you for that question, Naya. If you guys have questions, drop them in the chat. We have about 10 minutes until Mr. Hill Harper will be speaking. And so we're just going to go through some of the questions until then. We are meeting with Dr. Daniels right now. He is a family medicine physician, and he specializes in sports medicine for those who are joining us. So let's go ahead and go through. Let's see. So Mr. Derek Webb is asking you, even though you're a family medicine physician, are you able to rotate in all specialties? For example, if you have a pregnant patient, would you be able to deliver the baby, or would an OBGYN deliver this baby?
That's excellent. So as a resident, you do rotate through all specialties. Now, as what I call a attending physician, when you're completely finished, you can deliver babies. So I don't personally do it anymore, but if I wanted to, I could. So I'm able to do that. When you're a resident in family medicine, you rotate through all different specialties. As a general practitioner, you have to learn all different types of things. And with family medicine, that you're able to learn those types of things. I think also with family medicine, it's really unique compared to internal medicine, is that you take care of children. And the same thing with family medicine compared to pediatrics, you take care of adults. So you take care of all types of people. And I have colleagues who are who practice obstetrics, and they do deliver babies as family medicine physicians. So they have their own clinics and where they just see pregnant women. I still take care of women's health in terms of I do make sure that women are getting their breast examinations, making sure that they get their mammograms, making sure that they're getting their pap smears to prevent having cervical cancer. So I still take care of women. I just don't deliver babies. But there are family medicine physicians who do. There are quite a few actually who do that.
It's awesome. It's awesome. So going back to that MCAT question, it's usually a hot topic among pre-meds, and you know, somebody wants to know what you did differently during the third MCAT. I know you said you took it, you reapplied, and you were successful. But can you kind of get down to the nitty-gritty about what did you do exactly different? Did you study different? Do you meet with a group? How did you go about that, Dr. Daniels?
I think what also helped me was that I was in a structured MCAT prep program in terms of trying to learn the material and stuff on my own. So I really think that helped. Some people can do that and do that great without like a structured formal class. My wife was able to do that. I think I just needed that help. And also, you will see that people learn differently. People learn with watching videos. People learn with cards. So I think I just needed that extra help seeing it in like a class format, just compared to just doing it on my own. So that's where it really pushed me over. And I think that just comes down to my style of learning for this particular type of test.
Yeah, that's very big. I think knowing how best you learn is one thing that will get you through a lot of these different phases in life, especially with medical school. I'm not there yet, but from what I've learned from medical school,
there.
there's a lot of resources. There's a lot of resources that they're available to you now, especially, you know, in this technological age. So just figuring out what works best for you, right? If you are an auditory learner, you better stick with listening to, you know, your textbooks. If you like the visuals, maybe an Anki deck might be best for you. So really just sticking to what you know is going to be successful for you. And I think having accountability partners is awesome as well. Having people that are on the journey with you that can help keep you centered and grounded. So, you know, sometimes when you're just thinking about, dang, can I really do this? They can help you and encourage you. So thank you so much for that, Dr. Daniels. I see Dejana with the questions. I love it. If you guys have any questions, drop them in the chat. Just with Dr. Hill Harper, Mr. Hill Harper will be speaking in about 5 minutes, but we'll try and go till it gets closer to that, because I know we still have some questions. But for you, Dr. Daniel, how do you manage your work-life balance? For example, there are so many Black students who may want your mentorship and few Black doctors. So I imagine you might feel overly stretched sometimes. So how do you know when to say no to things? That is good. Ooh, boundaries.
That is an excellent question. And it comes down to prioritization. Pretty much you have to prioritize things. What's important to you? So there's really 3 things that are important to me. Faith, my faith in God, that comes number 1. Number 2, my family. Number 3 is being a physician. Underneath that umbrella of being a physician is the mentoring. So when I am managing and balancing different types of things, mentoring is one of the things that I know I have to do because I have to pull the next generation through. I made it through this pipeline, and I wouldn't have been able to make it through the pipeline if I didn't have mentors there who were ahead of me. Now, if there is some individuals who reach out to me and I'm not able to help them necessarily, or I feel overloaded, I'm not going to push them away. What I'm going to do, I'm going to reach out to my community, people I know, to say, hey, there's this student who's interested in this, this, and this. Can you help them out? And I think that's what you'll see throughout your career, is that you're going to have to be able to manage things. You're going to have to be able to know when to say yes and when to say no. And it really comes down to what you is really important to you. And when you take overlook at the whole situation, if I'm able to help this person, or am I able to do this task, what's the benefit of the task? Does the task go in line with the things that I feel in line with? It really comes down to that. So you're thrown, even now as a physician, I'm thrown with so many opportunities. I have to really bring it in back to see, hey, if this is in line with my goals, does this take away from too much time away from those other things? Is it taken away from my church time? Is it taken away from my family? Is
Dr.
it
Daniels,
in line with
I'm
my
really
goals?
sorry to interrupt. I've been asked to let you know that the keynote is about to start.
Okay, thank you. So those are the things. So pretty much, if it is in line with your goals and what you want to do, then go for it.
Awesome. Dr. Daniels, you have been a pleasure. Thank you so much for being here. If would you be okay to drop your email in the chat for any of our attendees and listeners to reach out to you? I know we had one person that was interested, but this has been awesome. Thank you so much for your time today.
No problem. Thank you for having me. Take care.
All right. Thank you, everyone. All right. We'll see you in the next session.